Good morning, everyone, and welcome to today's Outreach Connection webinar for childcare centers from our Childcare Center Licensing Unit. We are going to get started. It's just 11 o'clock right now, so we will kick things off. My name is Emma Kurth, and I am a Childcare Center Training Specialist within the Licensing Unit, and I'm today's webinar host. I'm joined by a few of my colleagues who will introduce themselves as they present updates from their areas as we go on today. Outreach Connection webinars are one way that we, as the licensing and certification team, have worked to bring relevant information together from us and from some of our state partners to make sure that you're hearing information and updates directly from us, in addition to some of the other ways we communicate information, like via email or through our website. We work hard to connect with you and to hear from you and to partner in ways to support the work that you do for children and families of Minnesota. And today's presentation is just that. It is a way for us to connect with you and provide what we hope will be valuable and useful information. Before we get started, we have just a couple housekeeping items to go over. First, an accessible handout with links to more information and resources from today's Outreach Connection webinar has been created, and there is a QR code here on this slide, and it was on that welcome slide as well, that you can scan for the handout. It's also posted to our DCYF Childcare Center Certification website under the Webinars and Outreach section, and then under Outreach Connection Webinars heading, and you'll see a link for a handout. I'm also going to go ahead and drop the link to that handout in the chat in just a minute or two. Second, today's presentation is being recorded, and the recording will be posted on our website as soon as it can be transcribed, so likely look for that in a few weeks. And now on to our agenda for this morning. We have heard from license holders that there are certain topics and partners that they want to hear more from or hear more about. So we have invited those content experts from several of our partners within the agency to share information and updates on their work. As we go through the presentation today, please put any questions you have for our panelists into the chat box and send it to everyone. We will take a break about halfway through to answer questions that have come up in the chat box from the legislative section, the CCAP section, Provider Hub section, and Great Start section. We'll pause after Great Start to answer any questions that have come up in the meantime, and then we'll round out our time together with our certification reminders and the top 5 citations from 2025 for certified programs. And with that, I will hand it over to my colleague, Karen.
Good morning, everyone. I'm Karen Kunze. I'm a policy analyst in the Office of Inspector General, and here today to give a brief legislative update. Go to the next slide. If you've been following the news, you know that the legislative session just ended yesterday. And as is pretty typical, there was a flurry of activity at the very end. So we are reviewing what passed and looking at what impacts certified childcare programs. And we'll be communicating any changes with all of you about those impacts in the coming weeks. So as is customary, we'll send out a Gov Delivery email to all of you with a legislative implementation plan outlining any changes that impact certified centers. If you aren't on our certified center listserv, encourage you to sign up or have your colleagues sign up for that on the certified center website. So we'll be in touch in the coming weeks with more news. And with that, I'll pass it along to my CCAP colleagues.
All right. Good morning, everyone. My name is Stephanie Palendi, and I'm part of the Child Care Assistance Program. I work as a provider support lead analyst, and I'm here today with my coworker, Brianne, to discuss some of the upcoming changes in CCAP record-keeping requirements. We'll be discussing the electronic attendance rollout that will begin for some of our licensed centers this next month. So we're going to provide some information and some updates about the implementation of this rollout. All right, next slide.
Hi, everyone. My name is Brianne Peterson with the Child Care Assistance Program, presenting here Stephanie. So what is this upcoming attendance requirement? We are starting this in phases. So starting this June, some providers, it's about 80, are going to be required to submit electronic attendance records to keep participating in CCAP. So eventually this requirement is going to roll out to all providers who are participating in CCAP, including certified childcare providers. What I can tell you is that that's likely not going to happen for certified providers this year in 2026. And you'll also get a 90-day notice before it is required for your program. So providers who are part of this first rollout in June, they receive their 90-day notice in March 19th. And there is statutory language to support this requirement for our program to collect these attendance records. Attendance records will be submitted using the Provider Hub. There is currently an enrollment and attendance feature in the Provider Hub that was developed for Great Start scholarships, or excuse me, the Great Start Compensation Support Payment Program. They're not currently requiring any providers to use that feature, but it is available. And we have been working with a vendor to improve that feature. We knew that there were some bugs that we wanted to address and wanted to make it more user-friendly. So we've been working with that vendor to make those improvements before June 22nd. And later on in the presentation, I'll give more detail on exactly how providers can submit that information. We can go to the next slide.
Okay, so we wanted to take a moment to acknowledge that there are a few things that will be changing, but largely requirements for attendance record keeping will stay the same. So providers are still going to be expected to keep daily accurate attendance records. And those records will have to include the date, the child's first and last name, the drop-off and pickup times entered to the extent possible by the folks that are dropping off and picking up. So all of the components that are required to record a complete attendance record are still going to be in place. The thing that's really changing is the format of these attendance records, and for some providers, how these records will be submitted. So in the next slide, Brienne's going to talk about the different submission methods and how providers can use the enrollment and attendance feature in the Provider Hub to submit their attendance records electronically. Next slide.
So there's 3 different ways providers can use in the Provider Hub to submit their attendance records. The first is using their child care management system, also known as CCMS. So, for example, many certified centers use LEO to record their attendance. And licensed centers use systems such as Brightwheel, Daily Connect to do that. There's many of these systems out there. We're currently have an integration with Brightwheel, Daily Connect, and ARUX. So when providers are using those systems, they can agree to have that information be sent over to the state of Minnesota. And that's done either on a nightly or real-time basis. And we get that information, and that meets the attendance requirement. So this is the easiest way because it requires very little work on your end. You just keep using the system you're using, do that one-time agreement, and we get all the information that we need. The work is really on our end and the vendor end to work together and to get that integration set up. So like I said, we currently have that with 3 CCMS systems, and we are working to work with more systems. And our goal is to integrate with as many of these systems as possible so that providers can choose these systems, choose whatever works best for their program, and it also meets our need to get the attendance information. So that's the first way. The second way is a kiosk feature in the Provider Hub. And again, this is currently available, so if you're curious, you could go click around, see what it looks like. And this is basically electronic attendance that's recorded right in the Provider Hub. And you enroll the children, you enroll their parents, the parents get a PIN code, and they can use that at pickup and drop off to record the attendance, and it's all done in real time. So if you're not currently using a CCMS system, this is also a pretty easy way to do so. There's a little bit of work up front to get all that information in the Provider Hub and training, your program and parents on how to use this, but it works very well. The last, uh, the last option is an import attendance feature. So if you're using a CCMS system that is not integrated with the state of Minnesota, you do have the option to manually import all that information into an Excel sheet and upload that. And then the state gets that information. That does take a little bit more work, and we are trying to, again, integrate with as many of these CCMS systems as possible to reduce the number of providers who need to use this import attendance feature. You can go to the next slide.
Okay, so you know, because this might be a bigger transition for some providers, you know, we wanted to take a moment to outline sort of the role of the providers throughout this rollout, and then also the role of DCYF. So providers will continue to, you know, follow attendance record requirements. So making sure that records are completed daily and they're accurate, and they require all, or they have all of the required components. You know, those attendance records will also have in and out times entered by, to the extent possible, people picking up and dropping off children. Um, you know, keeping attendance records at the site where the services are delivered, that's also going to continue to be a requirement for providers. They have to keep them on site for 6 years after the date of service, and making those records immediately available upon request by a CCAP agency or DCYF. When records when keeping records electronically, if asked to give records on site, providers have to ensure that they can produce records in a format that meets all of those legal requirements, and access and supply records immediately when requested. Another role of providers throughout this rollout is to continue asking questions. You know, this is an ongoing sort of phased implementation. So asking questions kind of helps us to inform and refine our process as we go. If you don't know something, or if you have a question about something, just ask. Later on, there's going to be a slide with some contact information. You can contact our provider support team if you do have any questions. And then providers need to remember that, you know, attendance record requirements are going to stay the same, and the only thing that's changing is the format of the attendance records, and again, in some cases, how they're collected. Keeping accurate daily attendance records is a condition of payment for CCAP, so a failure to comply with these could result in correction orders, overpayments, or other actions. But it isn't changing from what currently exists and how attendance records are currently being used for compliance. So that's the role of providers. I'm going to pass it to Brianne to discuss the role of DCYF.
So we are committed to providing up-to-date resources for you. We do have a new website that we created with updates on how the progress is going. So there's a lot of good information on this website, that minnesotadcyf.us engagement HQ. So I definitely encourage you to visit that. There's also, I believe, still a survey on that website, and we are collecting information on what kind of CCMS vendors providers are using. And we are looking at those results and prioritizing the ones that are most used in conversations with vendors and who to integrate with next. So it's very valuable information for us. We also do have a monthly CCAP Provider Insider newsletter. So if you are registered with CCAP, you should be getting those newsletters. If not, you can let us know and we'll add you to the list, but we're keeping providers updated using that newsletter as well as the Engagement HQ website. And we'll also have formal communications sent to providers, like I mentioned, 90 days before you are required to use electronic attendance, you will receive a formal letter letting you know of the requirement and what day that begins. And then we're also hosting different engagements, getting feedback from providers, working with provider organizations, working with counties to get information, share information, hear feedback. And this month, before the requirement starts next month, June 22nd, for those 80 providers, but we're starting a pilot right now. So we're already working with providers and they've started to submit some some attendance information in a testing environment to make sure that the process makes sense and that we have appropriate resources for them. We're also planning some training sessions to give everybody the information they need.
All right. So yeah, as Brianne had referenced in the previous slide, we do have a public-facing website, and I saw that Katie went ahead and put the link in the chat as well. There's a QR code if you wanted to scan it. It'll take you to the website. So this is a screenshot of what our Engagement HQ website looks like. So on the landing page, you'll find some information about the rollout and the reason behind this rollout. You know, as Brianna had also mentioned, there's a live attendance record keeping survey there. We are trying to collect information from current CCMS vendors that our providers are using, because it'll help us to prioritize CCMS integrations moving forward. Another handy dandy part of this website is our FAQ section, our frequently asked questions section that's on the right-hand side of the page. We have been getting lots of questions from providers, so that helps to inform our FAQ area. Later today, you'll see an updated list of those frequently asked questions. So I encourage you all to, visit this page. It's our way to try to get information out as quickly as possible to providers. As you know, there's lots of questions around this new requirement. So encourage you all to visit this page and, you know, scan the QR code and bookmark it. If you still have any like lingering questions, or if you would like additional support, you'll see on this page as well, we have our shared email box that will go to our provider support team. So encourage you all to reach out to that ccap.providers.dcyf email address to get some support and some answers to questions you all might have. Next slide.
There's some additional resources. I think Stephanie covered these first two. That's our email address if you have additional questions. This is the CCAP team email, so the people who register you and help you get set up with online billing, we're that team. And we can also answer some of these questions about electronic attendance. And then, of course, like we've mentioned, this Engagement HQ website, but I do want to draw your attention to this third bullet. This takes you to a current e-learning course on what the current enrollment and attendance feature is in the Provider Hub. And it goes through some training on how to work with the system currently. So some of this is going to be relevant. I do want to call out this import attendance feature, also referred to as bulk upload. We're making pretty substantial improvements to that. So I would recommend just disregarding any of that information right now and not even looking at that right now. Because it's going to be changing pretty significantly. But after June 22nd, if you think that's a feature you might be using, definitely take a look. It'll be new and improved, and you can test it out. But if you want to look at information on how those CCMS integrations work or the kiosk mode work, those resources should be pretty much the same. So you can take a look and kind of explore that and see what's up. Thank you, everyone.
Hi, folks. I'm up next. This is Katie Lane. My role is the lead instructional designer for the Provider Hub. So this tool that you're using to manage your childcare certification. I'm going to cover a few topics today about the Provider Hub, a quick overview of what the tool is, some recent and upcoming improvements that are being made to the tool, ways to connect and get regular information about the Provider Hub, how to get help using the Provider Hub, and lastly, some opportunities to share your feedback on how the Provider Hub looks and behave to inform how we can keep improving the tool for you. Next slide, please. So the Provider Hub, this is the online tool where you can apply for social service licenses and certifications, funding, and programs. You can access it from any device and log in anytime. It is available in English, Hmong, Somali, and Spanish, and its current features are Child Care Center certification, also certain licensing, CCAP, Great Start Compensation Support Payment Program, and enrollment and attendance. Next slide. This slide talks about upcoming releases for the Provider Hub. Releases are specific improvements made in the online tool. And these are resources that are across the online tool that impact all of our users. So back in February, we had some updates around case submission enhancements. We're giving you some more room to add your information in a field. Also some CCAP registration enhancements back in February. Last month, our team made some fixes to the application, addressed some bugs that were happening in there. And then coming up, likely this June, there are going to be those enrollment and attendance enhancements beginning to roll out that Stephanie and Brianne talked about. Can go ahead to the next slide, please. If you want to get more information about those releases, what's happening in the Provider Hub, you can find all that information on the Provider Hub website, which I'm going to drop the link in the chat for you right now. We have information there about our release notes. Again, those share specific improvements about the tool. It's sent to current users, so center operators of certified child care centers and any other Provider Hub users with delegated authority access will receive those release notes. And on our website that I linked, you can find links to previous release notes. So if you're really excited about tech and what's going on, you can find all the details there. On our webpage, we also have newsletters, and those are sent just to subscribers. Gives you general information about the Provider Hub, like new features, new and upcoming resources like learning resources, tips for using the tool effectively, upcoming events. The newsletters are available in English, Spanish, Hmong, and Somali. And links to previous editions are found on that website. Go ahead to the next slide. Now I'm going to share with you a little bit more about getting help using the Provider Hub. You know, as Brianne and Stephanie were sharing, they have some specific resources on how really to use like the CCAP tool. The resources we have are really around the technical aspects of completing tasks within the Provider Hub. The best way to find articles is really through our learning libraries. Learning libraries are collections of resources based on grouped by who you are and what you're doing in the Provider Hub. Those are also on the Provider Hub webpage. I'm going to drop some links for you right now around our Provider Hub basics, as well as certified childcare learning libraries. All of these articles can be accessed without logging into the Provider Hub and are available to you anytime you need to use them. Next slide, please. Beyond accessing those articles and some e-learning courses we have about the Provider Hub, you can also get support from our product success team, aka some of the most helpful people I know. You can connect with them in two ways. You can submit a case within the Provider Hub itself through the Help and Resources section. You'll have to open it up through the More tab on the very top of the screen. You can give them a call at the number listed there. And if someone is not able to answer your call right away, please be sure to leave a voicemail with your name, program name, your phone number, and your questions. Our product success team wants to make sure to get back to you and support you with your question. So be sure to leave who you are and your phone number, how to best get in touch with you. Next slide. This team, they respond to their cases Monday through Friday, 8 to 4:30, and their goal is to respond to you within 24 hours if you don't reach them right away. They will follow up with you based on how you contact them. So if you submit a case through the provider hub itself, they're going to answer your question through a case in the provider hub. And you'll get a little notification within the provider hub once they respond to you. And similarly, if you left a voicemail, they'll get back to you by phone. Next slide. So lastly, it talks about what the provider hub is, ways to get more information, ways to get help in a variety of ways. The last thing I want to share with you is how to give us feedback on how the provider hub is or isn't working for you. We have a team of user experience designers who want to get your feedback on how the tool is working. So they will do design research. Their aim with design research is to take your feedback on how the provider hub looks, how it behaves, and that will inform us on how we can keep making improvements for the online tool to make sure it meets your needs in a familiar, functional way. And there are a variety of ways to give your feedback. You can do it through a short survey or full on interacting with some prototypes that we've had or new features. But remember, this isn't a test for you. This is really a test for the tool, a test for the product. To participate in some of this research, you'll need access to internet and a computer, plus a microphone and a camera if you're going to do a virtual session. I'm going to drop the link in the chat on how to sign up if that's something that's of interest to you. All right. And now, once I drop those links, I'm going to pass it on to Dana for her section. Thanks.
Thank you so much, Katie. Yes, my name is Dana Ellingson from the Great Start Compensation Support Payment Program, and I want to be able to give you some updates that maybe you've already heard of from Gov delivery messages, but I want to make sure you hear it in different ways. So here we go. The first slide that we have for you, you had previously heard from other individuals today about the updates, improvements, and maybe some requirements coming for the enrollment and attendance feature in the Provider Hub. And we want to provide any updates about the requirements to use this feature in connection with your monthly Great Start compensation application. So at some point in the future, using the enrollment attendance feature will become a required step in completing the monthly Great Start compensation application. But on this slide, we're emphasizing that a start date for this requirement has not been set yet. So once a date is determined, you will receive at least 90 days notice before it goes into effect. That timeline is intentional to give you enough time to prepare, ask questions, receive support, and using the enrollment and attendance feature in relation to the Great Start compensation application. The next slide here is sharing an update that took effect on April 1st, 2026. Starting on that date, child care centers that are licensed or certified by the state or centers licensed by a tribal nation will no longer be able to use the Great Start compensation funds for certain types of expenses. As we move along and we grow and we understand, we find out more information and make some adaptations here. Specifically, the funds may not be used for food, such as appreciation meals, special treats. They also may not be used for events, including team building activities, staff appreciation outings, and finally, the funds cannot be used for gifts for staff, like art supplies or clothing reimbursement. The reason for this change is that these items are not considered increased in compensation under the program rules. So beginning April 1st, those expenses will not be allowed under the Great Start compensation uses. So moving to the next slide, we're excited to share that the $375 per FTE full-time equivalent amount will continue through the June 2027 Great Start compensation round. So this continuation doesn't change how you complete the application, but we know having the stability of understanding really supports your program's business planning, and we want to help you to look ahead with confidence. So $375 per FTE continues through June 2027. This concludes all the updates our team has for you, but do know in your handout there is information to reach our support team. And as Katie mentioned, there's also a way to reach us through the help navigation, that the visual that Katie gave you, to be able to connect with our team that way as well. Thank you so much. I'm going to be handing it back to Emma.
Thanks, Dana. We are going to just take a pause here and make sure that we have answered all of the questions from the chat on this section before we move into our certified updates. Let's make sure. It seems like everything that's come through has been able to be answered. Alva asked whether the CCAP trainings would be available in other languages, and it sounds like Brianne's going to take that back to the team and inquire. Tiffany Weeks has asked, is there any planned enhancement to be able to search historic Great Start applications so that I don't have to scroll through hundreds of applications to find the one I'm looking for? Dana, is that one that you're able to address?
Well, I'll address it in that we're definitely taking note of that, and we'll bring it to our team for our product managers and hope to get an answer back to you. Thank you so much for that. One suggestion, my guess is it isn't the first time that our team has heard about it, so I'll look into it and be able to get back to you, but I can't answer on the spot right now if it is in the works.
All right, and then we have one from Kelsey. Is Great Start ending in June 2027, or is that just when the rate may change?
We have no understanding of this program ending, as it is a program that's in statutes. It is a state program, and so just announcing the continuation of the FTE 375, and as we will hope to sometime near this date next year be able to announce more information on ongoing funding amounts.
Excellent. Thanks, Dana. That is all the questions from the chat at this time. If you have further questions, make sure you keep adding them. We'll have more time at the end for questions. There are a bunch of great resource links in the chat already, and those are also going to be in your handout as well. All right, we are going to continue on into the next half of our presentation for today, our childcare certification information and updates. So I'll hand it off to Michelle and Carrie.
Good morning. This is Carrie Leith. I am the supervisor for certified programs. First of all, I want to acknowledge all of you that are out working in the certified programs. I understand this is a crazy time of year as you're winding down your school year programming and winding up for your summer. So we appreciate that you're taking the time to be with us today, and we're wishing you all the best in this transition that you'll be doing in the next few weeks here into your summer programming. We want to take this opportunity just to give you some reminders about things that might be happening that you'll be going through over the summer. And so the first one is some of your summer site changes. So many of you experienced these changes during the transition from school year to summer. All changes will require a change request to be submitted within the hub for approval from your licensor. Instructions on how to submit a change request can be found in the Help and Resource tab in the Provider Hub that Katie explained earlier in her presentation. Change requests need to be submitted for each location. So you'll be required to submit a floor plan, a fire inspection that has been approved within the last 3 years with no open violations, an updated risk reduction plan, and an emergency preparedness plan. Some examples of the changes that you may need to submit are a change in location. So as a reminder, if you submit a change request for the summer, you'll need to also submit a change request in the Provider Hub in the fall if your center is moving back to its original location. So for example, if you have a center that moved from a school to a church for the summer, you'll need to submit a change request for approval from your licensor prior to moving to the church at the beginning of the summer, and then another change request is needed to move back to the school in the fall. Change in operating schedule and operating hours. If your program normally operates for a full year, but you'll not be operating during the summer, the operating hours will need to be changed to state the start date. So for example, the start date could be September 2nd, 2025, with an end date of 6/6 of 2026. And in that description, you'd change that to indicate that it is the school year. If you have a program that normally operates during the school year, but will be adding summer hours, you'll need to submit multiple operating schedules in one change request. So for example, you would put in the description, the school year, a start date such as 9/2/2025, an end date such as 6/1/2026, and enter before and after school hours for each day. Would also enter a description of summer with your start date such as 6/6/2026 and an end date of 9/8/2026, or whatever that date may be in your case, and you would enter those summer hours for each day. Just a reminder again, you'll need to submit a new change request for the next school year. And if you're using a temporary building location, so if your center will need to move to a temporary location for any amount of time, we require that you submit a change request for prior approval from your licensor. You'll be required to submit that floor plan, a fire inspection, an updated risk reduction plan, and emergency preparedness plan. What we often see is if you're in a summer location in a public school and the school needs time to clean and gives you that 2 weeks that you can't operate, if you're not closing your program and you want to operate elsewhere, you would need to submit that change request. Emma, we can go ahead and move to the next slide. This is just a reminder that your Net Study 2.0 rosters must be kept to date for all site locations. Staff must be affiliated with each location that they'll be working at. So for example, if you have a staff person that works at a school year only program during the school, but will be working at a different location offering summer care during the summer, that staff person must be affiliated with both the school year certified program and the summer certified program. Also want to take the opportunity to remind you to update those rosters. So if you have anyone that has left and will not be returning to work for you, you should remove that from your roster when you are able to. Emma, we can move to the next slide. If you'll be utilizing a secondary building location for short-term daily activities, such as eating lunch at the high school across the street, you must communicate this with your licensor, and you'll be required to submit that floor plan, a fire inspection, the updated risk reduction, and the emergency preparedness plan for that space. And we can move to the next slide. If school-age children will be administering their own sunscreen, they can do so if supervised by a staff person. Staff are required to supervise school-age children when they're applying the sunscreen. You'll also need to have written parental permission that you have on site that allows you to apply that sunscreen to children and let children apply that to themselves. Having a system for children when we're thinking about children's additional activities outside of the certified program. So you'll need to come up with a system to sign those children in and out of your center to clarify when a center is responsible for a child and when the child is the responsibility of another program or service. For example, when a child who attends another program activity, such as golf, swimming lessons, art class, tutoring, that is not part of your certified program, and they go to that after being dropped off at your certified program and being signed in the morning, you must have a system to sign that child out to maintain proper documentation regarding where that child is at and who is responsible. When the child returns from the other program, the child must be signed back into the certified program. So keep in mind, written parent permission must be obtained for the center to sign a child out and for that child to attend that other program. When a child goes directly from a program or activity to the certified center without parent or legal guardian drop-off, the child is not considered in attendance until the other program delivers the child to the certified center or to a certified center staff person. The child must be signed into the certified center upon arrival. And when a child is transported by a certified center, the child is considered in attendance during transportation. And with that, I am going to pass it over to Michelle Hatlily.
Yeah, Carrie, there's 2 questions regarding your section. If we want to just answer those quick prior.
Oh, sure, go ahead. Yep.
Let's see. Yes, you'll be entering change requests in the provider hub. That was one of them. And then there was a question from Tiffany. Could a section be added to the hub where we can put our school year operating hours and our summer operating hours so that we don't need to submit these change requests twice a year, every year? Or could it be set to a default back to our school year hours at the end of our summer hours? With that, Tiffany, I'm assuming you're talking about just change in operating hours versus change in location. Change in location you have to do every time you move. Change in operating hours, you can put your entire year in one change request. It doesn't have to be twice a year. Anything to add, Carrie?
No. Nope. You explained that all well. Please let us know if there's any additional questions that you have.
And then, Carrie, do you want to answer Tiffany's next question about permission?
Okay. So it's Tiffany, if you're for parent permission, we talked about it a couple different times, but yes, you should always have parent permission if you are signing a child out to go to another activity and signing them back into your program. And the same would apply if you're with sunscreens, if that's the parent permission you were applying, that you would need that during the school year as well.
Perfect. Okay, I think we're caught up. So, hello everyone, my name is Michelle Hatlily. I am one of the certification licensors. I am going to be talking to you about the top 5 citations of 2025. I'll be going over each area and what the requirements are, sharing some examples of what recent noncompliance looks like, as well as ways to best set yourself up to be able to maintain compliance. So you can move on, thank you. So the first area that I'm going to be talking about is orientation for new staff. Orientation requirements have many different components. A key compliance tip for orientation is your documentation. It is required that you document the date of employment, the red arrow, the first contact with children supervised date, the green arrow, and the first contact with children unsupervised date, the blue arrow. These should all be documented in the provider hub as they are required. On the slide, you can see an example of where you will document orientation dates for each staff person in the Provider Hub. A commonly non-compliant area within the orientation dates is the misunderstanding of the date of employment, the supervised date, and the unsupervised date. If you have a staff person start, but their first few days are spent training and not having any contact with children, make sure to document this correctly in the Hub. The date of employment is the first day the staff person starts working. In this case, it would be their first date of the training day. Once the staff person has contact with children, you will enter that date in the first contact with children supervised section, the green arrow. In this case, the date of the first contact should be different than their hire date. If your staff person is with children on their first date of hire, the red arrow and the green arrow should reflect the same date as seen here on this slide. You will notice that under the last name box, there is a box to check if this person is ever alone with children without another staff person. That's the yellow arrow. It is very important that you check the box if the staff person works unsupervised with children. Once you check that box, it will then automatically require you to enter the first contact with children unsupervised date, the blue arrow. Entering this date in the Hub will ensure that the licensor has the information that they need and will save you time for searching for documentation during the visit. Currently, we are accepting paper forms as documentation if there is a discrepancy with the information in the Hub. Using a paper or electronic form as a backup isn't required, but is suggested. We do have a form on our website to use if you choose under the downloaded forms section. Make sure that you're using the one titled Orientation for your new hires. You will see another form titled Yearly In-Service, but this is only for tracking annual trainings and not for orientation. They do look the same, but have different requirements and different information. You can move to the next slide. So orientation statute states, a certified center must ensure the director and all staff persons, substitutes, and unsupervised volunteers are trained at orientation and on health and safety requirements according to statute requirements. The orientation training must include information about the topics listed here on this slide. So there are 3 timeframes to follow for orientation. The first box are trainings required before a staff person has any contact with children. So they need to have AHT completed if they are working with the children under school age, and they need to have SUID completed if they are working with infants. And this needs to be completed before they have any contact. The second box are trainings that need to be completed within 14 days of the first date of direct contact with children. This box lists what is required within the 14 days. You can see here, it is all the health and safety policies and procedures. I just want to call out that the emergency preparedness and the risk reduction policy trainings are site specific. And then the last box are trainings that need to be completed within the first 90 days of first date of direct contact with a child. So you have 90 days to complete the 2 hours of child development and learning training, as well as the pediatric first aid and CPR training. What we find most often here is specific items that get missed in orientation. So make sure you are training on all the requirements. Once the trainings are completed, make sure you are documenting the training dates in the Hub for each staff person. And another thing to remember is that until orientation is fully completed, all these trainings are completed, staff persons must be supervised while providing direct care to child. A staff person's first date of unsupervised contact should never be before the full completion of their orientation. These dates are so important to record and to get accurate. We must see documentation to prove that programs are meeting the orientation requirements, and this is why the difference between the hire date, supervised date, and unsupervised date are so important. You can move to the next slide regarding allergy forms. Next, I'll be talking about allergy forms, specifically the first bullet and the last bullet regarding preventing and responding to allergies. So statute states, before admitting a child to care, the certified center must obtain documentation of any known allergies from the child's parent or legal guardian. The certified center must maintain current allergy information in each child's record. The allergy information must include, and then underneath there, you can see it lists all of the requirements. And then the last bullet, a child's allergy information must be available at all times, including on-site, when on a field trip, and during transportation. Food allergy information must be readily available to staff in an area where food is served and prepared. Your documentation skills are critical for compliance with these requirements. It is so important to make sure that you are getting all of the required information from the family and that then you are reviewing the form for completeness, then training each staff person on the information and documenting it, as well as making all the required food allergy information available both where food is prepared and where it is served. The next slide will show you an example of an allergy form. Our key compliance tips for allergies are to use our form to document information and to train staff at least once each year on the plan. In addition, staff must be retrained whenever a child's allergy plan changes. This DCYF form is not required for you to use. However, all of the information on this form is required. What you see on the slide is our DCYF allergy form completed with an example allergy. Our form has the requirements that need to be filled out completely. You ensure that you are covering all of the areas that you need. No matter the type of allergy, be sure to get the full information from the family. As an example, in the techniques section of the allergy form, it has to say more than "we won't serve it" or "staff are trained," because a child might have an exposure and then show up to your program. So we need to see exactly what your plan will be. The best way to make sure the allergy form is completed is to have someone review the form once it is received to ensure that all required information is documented. Common citations found on the allergy form are in the triggers, the techniques, and the doctor's contact information sections. Make sure these sections are completely filled out and explain what your program will do if needed. It is also required that all staff, substitutes, unsupervised volunteers, and director have reviewed and signed off on training. Documentation of training must include staff person's name and the date of the specific child's allergy training. This includes all substitutes and site directors, site leads that help out when the sites are short-staffed. So then the next slide is regarding medication forms and dates. Parts of this are going to feel kind of similar to what we just covered in allergies. What you see on the slide is the required statute language for medication in a certified center. I'm not going to read it all to you. The bolded parts are the areas where we have seen programs struggle to maintain compliance. So this mainly centers around obtaining permission for any kind of medicine, ensuring the child's first and last name are on the medication and it matches the name on the medication authorization form, returning the medication to the family or throwing it away if it's past the expiration date, completely filling out the medication authorization form with all required details, and accurately logging who gives the medicine and when. On the next slide, you'll see an example of the medication form. So just like with allergies, our key compliance tips here are to use our form to ensure you're gathering all required information. Again, you can see here that the DCYF form is completed as an example. The form is not required. However, if you use it and it is filled out completely, you should be good to go. So all the information on the form is required. Note that every section is completed with information, and it's important to be very specific with these forms. So for example, let's look at the name of the medication, the red arrow. The form is completed for Benadryl plus congestion. On these combination style medicines, we often see forms that are leaving out the plus congestion part and only writing Benadryl. Then when the licensor reviews the medicine and sees that it's actually Benadryl plus congestion, the form isn't matching the actual medication, and this would be out of compliance because the form is not representing the actual medicine that could be given to the child. This is the same issue that happens with brand name items that are listed on the form, but the medication itself is generic. So for example, if the form says Benadryl, but the medication is an off-brand allergy relief, making sure that they match is very critical. Another part, no, one more. Yep, thank you. Another part to highlight is the bottom portion of the form circled in red. This is a section that should be filled out when a medication has expired. Mark how it was disposed of and get a parent signature if returned, and the signature of the staff acknowledging disposal of medication. A new form needs to be completed once the family brings in the new medication. Whenever medication is administered, it needs to be documented in the medication log. That's the form on the right. The DCYF medication log form is not required. However, all the information is required. You can find both of these forms on our website. So our next area of compliance is the evacuation drills and shelter-in-place drills. Statute states that a certified center must conduct at least quarterly one evacuation drill and one shelter-in-place drill. The date and time of the drills must be documented. You can see on the slide, the 4 quarters are all laid out there on the right. So you got the fall quarter, the winter quarter, spring quarter, summer quarter, and then the months that correlate with each of those. Programs must complete these drills during their times of operation. And again, we have created drill logs for certified centers to use that can be found on our webpage as well. The form is not required. However, if you use it, all the information on there is required. And then our final area of compliance is the pediatric first aid and CPR. So statute states that before having unsupervised direct contact with child, but within 90 days after the first date of direct contact with the child, the director, all staff persons, substitutes, and unsupervised volunteers must successfully complete pediatric first aid and pediatric CPR training, unless the training has been completed within the previous 2 calendar years. The first thing is to ensure is that you're training on pediatric first aid and CPR. This often gets left out of programs when they're choosing a training and they don't specify that it's for children. So just making sure that it is pediatric first aid and CPR. Additionally, we have, while staff have 90 days from the first day of direct contact to complete these trainings, they cannot work alone with children before completing them. Until the training is completed, they must always be supervised by another staff person who has completed the training. This is a common out of compliance area. If 90 days pass and the training has not been done, the staff person cannot work with children until the training is completed. And then somewhat new requirements as of 1/1/26. Required training must include CPR and techniques for providing immediate care to people experience life-threatening cardiac emergencies, choking, bleeding, fractures and sprains, head injuries, poisoning, and burns. So if you use training developed by the American Heart Association, American Red Cross, or another organization that uses nationally recognized evidence-based guidelines, will meet those requirements. So just making sure you are meeting these new requirements when completing the pediatric first aid and CPR trainings. And that's all. And then here is our certified information. So we have Monday through Friday, 8 to 4:30. We have a licensor on call at all times. So you can always call them. You can call your own licensor, or you can email the dcyf.ccc.licensing at state email address. And then we do have our new certified childcare website.
Thanks, everyone. That's all we have for you today. I'm going to come back to the chat and make sure that we have answered anything last in there. Looks like we had a question for whether these were top citations for licensed and certified, or whether this is just certified. These are just the top 5 of 2025 for certified. We do have a presentation that includes the top 5 for licensed, and I'm about to drop that in the chat in just a moment here. And then we had another request for putting the main website again where the forms are living. And I see Carrie put the Certified Center page there as a response. And I will also add a direct link to just the forms page that links off that main page. And that's where you're going to find all those forms. And if you haven't worked a lot on those forms, it's important to note that you'll want to download our forms directly to your desktop and open with an Adobe program. Otherwise, they can get a little funny. If you try to open it in a browser, they just don't always work. So make sure you download to your desktop and open from there. Our team of panelists will hang out for another couple minutes just in case any other questions pop in. And I know we've given you a lot of information and a lot of resources today to learn more. But as Michelle said, if you have more questions or particular questions that come up as you're thinking about this later on, reach out to your licensor, or from there, your licensor can get you to the right partner if that's more applicable. So thank you for being here with us today. Hang on about another minute and I will get that link for the top 5 for licensed if that's applicable to you as well.
Hey, Tiffany, this is Katie Lane. I'm here representing most of our Provider Hub, I'm going to call Provider Hub General team. Looking at your question about if there's an update in the hub that would allow folks to search across sites to find all the places that staff is listed. I don't know the answer to that question. I would recommend contacting the Provider Hub email address to get that question answered. I don't have it right now, and I don't want to give you an answer to something I don't know. Let me track down that email address and drop it into the chat. And you have so many good questions, and I also want to plug again that we have our Provider Hub feedback where you can work with our design team to give feedback on how it's working or how it's not. Would love you to plug into that if you so desire. So let me grab that email address for you. One moment. Okay, I just dropped it in the chat for you. And Tiffany, I also wanted to come back to your question about being able to input multiple operating hours for your program if you have one operating hours in like during school year and one in the summer. There is a way to do that in the Provider Hub, and I'm going to drop the specific article that we have on that in the chat for you as well. So that article includes, oh, that's not a question for me. Fearless leader, Emma. Is it possible to unmute participants?
No, not as is. The settings are set for the current webinar so that I can't unmute attendees, unfortunately.
Bye.
Here we go, Tiffany. I got you off mute.
Okay, thank you. Sorry, I'm
Hey,
trying to
Tiffany.
I'm trying to respond in the chat and I can't respond fast enough.
No worries.
Yes, I do have that email and I've been part of all of the groups ever possible. School age care district-based programs have just been giving a lot of this feedback the whole time and we haven't seen any of these updates. So I was just trying to get some additional information, you know, whether that's coming or are, because I know the same things have been really highlighted from all the districts that run so many multiple site programs, and you know how clunky the hub is in all of it, you know, being able to find a staff when we need to remove them across 24 sites. There's no way for me to search across the sites. There's not a way to add a staff to multiple sites when we hire a staff. I know we can copy them, but we've long been asking, you know, could we just check, here's all the sites that this staff pertains to. And the updating the site schedules, I know that we can put in the summer schedule and the school year schedule in one update. But again, it's 24 sites. Even if there is a, you know, if there's just something where we can say, this is our school year schedule, this is our summer schedule, they don't change. Or even, you know, right now we have to say Monday and fill in Monday, Tuesday and fill in Tuesday, Wednesday. And like, could we fill in the schedule and then check all the days that schedule applies to? Would be a much easier way than typing the schedule 10
Much better
times.
user experience. Yeah. Yeah.
And then, yeah, just the searching the Great Start applications, because again, with 24 sites, 4 months worth of applications is 100 applications. So when I'm looking back to try to find one, and there is a search on the payment, like the historic payment. So it feels like that would be easy to implement on the applications. Like on the payment side, I can search by license number or, you know, payment amount, or, but that option, and it kind of looks like it's supposed to be there on the application side. Like there's some filter and search features that just are grayed out. But I can send all of this feedback to the provider hub email too. I just know, you know, since the very beginning, we've been submitting all this feedback in every group we've been in.
I wish I had a great answer for you.
Yeah.
Because I hear you loud and clear.
Yeah.
I can
There's
say like, there's a lot. There's a lot.
Yeah.
And there are many ways that the system could work better for you all.
Yeah, I just
alongside
think it's
the work you're doing with children.
Yeah, I just really think it's built for people who are running one center, or one home, you know, childcare provider, as opposed to those of us that have, you know, 8, 10, 15, 24 sites. It's just really trying to remove a staff when they leave is very difficult. And I know we miss them. I mean, I just know we have staff out there attached to sites that are no longer working for us because we just couldn't find them across all 24 locations.
Sure. Okay. Thank you for continuing to give this excellent feedback. I wish it was very simple to go in and make the changes that you all are asking for, the needed changes that you all are asking for.
Yeah. I'll
Please,
email it to the
please keep
provider hub
sending it.
email. Yeah.
Thank you.
Okay. Thank
Thank
you.
you. And thanks for the good work. You're welcome. Wish I had a
Yes.
different answer for you. Thank you.
We love the CCAP part of the hub. Just to throw in some
Amazing.
positives.
Amazing. Great.
Yes.
Where's
We
Brianne?
love,
Yay.
yeah, we love the CCAP piece. We love having one place to submit our provider authorizations instead of across, 6, 7 counties. That has been an amazing change and upgrade.
Hey, Tiffany, this is Dana from Great Start Compensation. Good to see you or hear you. Would you be willing to email me a little bit more in depth of the difficulty around non-historical listed applications,
Yeah.
so that I can make sure we get that into a story of some sort for enhancement if we can.
Yeah.
I feel like you've talked about that in the past though during pilots, so
Yeah.
it might already be on the list. I just want to make sure we have it documented, and if you would just shoot that over an email, we don't want to lose it.
Yep. Sounds good. I will do that. Thank you.
Thank you so much, Tiffany.
All right. Have a good afternoon, everyone.
All right. Thank you for your time, everyone. We are going to wrap here for today, and hope you have a great rest of your day.